Have you ever gotten to the end of a long day, finally home, finally quiet, finally able to sit and just take a breath and relax, only to realize that you're not hearing the sweet sounds of silence? Instead, you're hearing a noise that isn't actually coming from the outside world. Maybe it's a high-pitched ringing, or maybe it's a low rumble. Maybe it sounds like a dial tone, or ocean waves, or TV static. Whatever it is, it's really annoying. And it keeps you from relaxing. It keeps you from sleeping. Maybe it even makes it hard to focus on normal sounds like a conversation. Maybe it stresses you out and it drives you kind of nuts. So what does tinnitus have to do with period pain? Is it connected to hormone fluctuations? Is there anything we can do to treat it, or are we stuck with it forever?
What's happening to your body, we don't know, because we've never really studied the female body. Say it's all in my head, but the research is quite spotty. No, we've never really studied the female body. I go to the doctor to get dismissed. Try losing weight, you're just anxious. That's fine, that's cool, I'm not pissed. Just wait 10 years for a diagnosis. Psychosomatic, you're so dramatic. Hysterical, emotional, hormonal, erratic. Heart disease, chronic fatigue, depression and anxiety. Do you have pain? No, you don't, because you've never really studied the female body.
Welcome back to CRAMPED, the podcast where I try to find answers to my and other people's questions about their period pain. I'm your host, Kate Helen Downey. I hope that listening to this podcast feels like meeting a friend at a bar. And it just so happens that that friend has just done a ton of research on a really specific topic about period pain and can't wait to tell you all about it. So then think of the Patreon as a way to buy me a very cheap drink once a month while we're sitting at that bar. Is it worth it for all that info and research and other people's period pain stories? I hope so. Buy me a drink at a bar called patreon.com/cramped. It's not a very good bar name, but what are you going to do? And just a reminder, I'm not a doctor. This is not medical advice. Everything that I present in CRAMPED is my own and other people's personal experiences. I am just a research nerd with a uterus and a microphone sharing what I found. And today, what I have found is a really unexpected connection. I have a friend, shout out to Robbie in New York, and he works at an audiologist's office. He reached out to tell me that I should have one of the doctors at the practice on the show. This doctor is a specialist in tinnitus. I said, Robbie, this is a period pain podcast. What are you talking about? And then he sent me Dr. Natalie Crossland's info, and my mind was blown. Maybe I shouldn't be surprised anymore when I learn about a new way that our body's systems are all connected and in conversation with each other, but I am still surprised. So let's dive right in.
I am Natalie Crossland. I'm an audiologist who specializes in tinnitus management in New York City.
So is it tinnitus or is it tinnitus? I've always said tinnitus. Is that wrong?
No, it's not. Either is correct, technically. You'll typically hear professionals saying tinnitus. Itis suggests, even though it's spelled I-T-U-S in this case, but itis suggests that it's from infection or inflammation, which tinnitus is not technically. But you're not wrong if you say tinnitus, so don't worry.
Okay, that's good to know. That's good to know. Tell me about your period pain, Natalie.
Yeah, I have a story that is very much like a lot of other individuals that have dealt with endometriosis. Started my period at 11 and then just went through, oh my goodness, at least 2-3 days a month. I am out of commission for all of my teenage years. And then eventually it escalated to the point where I was no longer accepting like, oh, you're just one of those lucky women who has to deal with this all the time. Because I would be, just laying and whimpering and incapable of getting up. And I'm like, I don't think that I just have a low pain tolerance. I think that there's something more to this. And so eventually, after many, many times of the typical dismissals of, oh, just take birth control or just wait till you have a baby. Eventually, I was lucky enough to have my in-laws introduce me to a friend who's an OBGYN who said, yeah, let's do a laparoscopy. Like, as simple as that. You just had to find someone who was like, yeah, that sounds reasonable enough. And so eventually got to the point where finally there's a diagnosis of endometriosis. Even after the diagnosis, there's been a lot of ups and downs of what works, what doesn't work. And thankfully at 35, I feel like I'm in a pretty good spot. That was over half my life ago that all of this started. So it left me with a lifetime of kind of scars, I guess, or some medical trauma that thankfully is adversity that leads to treating people better, I think.
It's always really good to talk to a doctor who's like not even in the gynecological field who experiences this. I assume going through this helps you treat your patients better, even if it's outside of gynecology.
I certainly hope so.
And don't worry, I've talked to a psychologist about this. We do have medical trauma. Neglect and gaslighting, 100% is medical trauma. Like, it may not be as dramatic as other kinds of trauma, but like,
right.
it is.
Absolutely.
Okay, I'm going to ask the obvious question here. Ears are very far away from uteruses in the human body.
They are.
What does tinnitus or tinnitus have to do with period pain and perimenopause and menopause?
I tell all of my patients there is non-bothersome tinnitus and there's bothersome tinnitus.
Oh, and can you just define tinnitus for us right now?
Oh, yeah, absolutely. Good question. So tinnitus is a sound that we sometimes hear in our heads or in our ears that isn't necessarily there. It very, very commonly comes from some kind of change in our auditory system, and those changes might be very noticeable, like you had a sudden hearing loss from a firework going off by your ear, or it may be changes that are not perceived by us, but enough to trigger this tinnitus sound. We call it a maladaptive plastic change. When you hear neuroplasticity, usually we're talking about really good things, like we're trying to retrain our brain, or we're talking about positive changes like learning something new. So if you learn a new language, for example, and you practice over and over again, eventually you get to the point where you can just do whatever it is you're trying to do, like learning a new language, without problem. You just speak it fluently. That's because our brain forms new neural pathways and goes through a positive plastic change. But then our brain can also go through what we call a maladaptive plastic change, which unfortunately tinnitus is one of those. Thankfully, maladaptive means benign. It's not harmful in any kind of way. It's not hurting us, but it's not helping. It's maladaptive. And so in this context, the auditory system, there's been some kind of change. Maybe it was temporary, like wax. Maybe it was permanent, like sensory neural hearing loss coming on. Maybe those little hair cells broke down. Ultimately, the auditory part of our brain says, hey, there's something different happening. Let me react. And it triggers this activity. And then because of where all of this is happening, we're then hearing a noise. So that's what tinnitus is.
So yeah, you're literally hearing your brain have a disconnect from your ear.
Essentially, yeah.
That's cool, but also annoying. Yeah.
Yeah, absolutely. And thankfully, most people will experience non-bothersome tinnitus. So the way they talk about it is just like, oh, I have that, but I just ignore it. Or that's always there for me, but I don't think about it. It's not like this conscious effort that they're putting forth all the time to say, I am ignoring this. Their brain just categorizes it as a non-issue. But if someone has maybe a lot going on, hormonal changes, big things changing in their lives, trauma, something along those lines, then there's this other part of the brain that gets involved at the time that the tinnitus is coming on. It's called our limbic system, the part of our brain that's trying to categorize things as threats or non-threats. When all of these factors are bubbling up together, then the tinnitus and the limbic system start playing off of each other. You start to get bothersome tinnitus, which means that if you're stressed out, if you're tired, if something is not right in your life, your schedule's really off, it's going to fuel the tinnitus. And then if the tinnitus is louder, if we're noticing it more, we're more aware of it, our stress is going to go up. And then et cetera, on goes the feedback loop.
Like an eye twitch. Like I get an eye twitch when I'm like tired and stressed, and it's really annoying. If I'm going to film something, can't do that if my eye's twitching.
And then you're thinking about it more. Absolutely.
Wild. This reminds me, too, of the way that something like endometriosis interacts with the nervous system and how, like, our bodies know something is wrong, and so they're keying up the nervous system, which also makes our immune system more reactive and more, like, on edge, which also fuels the symptoms to get worse. And so it's just this vicious cycle that if you don't find a way to interrupt it, just gets worse and worse and worse.
Absolutely. A lot of the patients that I see who are women in their, 40s, 50s, and they're dealing with bothersome tinnitus around the time that they're also going through major hormone changes, you have to consider all of these factors. As someone who's in a specialized area of a specialized field, if I just only look at the tinnitus, I'm not looking as far as I need to. I need to open up my peripheral vision and say, okay, I need to look at this whole person and figure out, do I need to send them back to primary care or whatever it may be, instead of just focusing on this one specific thing. Because if you only get reactive when treating symptoms rather than becoming more proactive, it's not as good for the person who's seeking treatment.
That makes total sense. I'm guessing because there has been so little research into hormone fluctuations in perimenopause and menopause and how that affects all the systems of our body. But do you know if there is a connection between those hormonal shifts and something like tinnitus or just hearing?
As far as the hearing is concerned, thankfully those kind of changes don't typically cause any kind of significant hearing loss.
Oh my God, a rare win.
Yeah. Exactly. We don't get it enough. But yeah, it's not going to like wipe out your hearing, for example. There's not typically some kind of path that we're thinking like this person is going to lose their hearing because they're going through this hormonal change. However, if someone is experiencing, let's say, a lot of difficulty hearing in background noise, and every time they go to their audiologist or their ENT office, they're getting the same answer of, well, your hearing's normal, that doesn't give us the whole picture.
Man, that sounds familiar.
Yeah, exactly. Just like when you're explaining your significant period pain to the OB's office and they say, let's send you for an ultrasound. Just because the ultrasound came out normal doesn't give us everything. There have been a lot of studies to show that having estrogen in general at a level that is acceptable for our body gives us the higher ability or a more productive ability to hear in background noise, as opposed to when that drops, then we're having more difficulty hearing in background noise.
Wait, that's crazy. I thought this was a thing like after the pandemic. I was like, I can't hear at bars anymore. Like when I try to have a conversation at a bar, I can't focus on the person who's talking. I'm only hearing background noise. And I thought that was just like, oh, I wasn't in bars for like a year and a half and then I forgot how to do this. But I'm 37 now, so I think there were some hormonal shifts going on.
It could be a factor. Absolutely.
I want to make sure I understand this. A drop in estrogen contributes to not being able to hear a specific sound when there's background noise.
Like separate the speech from background noise, for example. So hearing when there's a lot of commotion going on. And there can be so many factors to that. There have been a lot of studies to see if musicians hear better in background noise, for example. And all of these studies show that, yes, they do. They do a lot better than the rest of us hearing in background noise because they've trained their brain to hear over different sounds. So there are a lot of factors that impact how we can hear in those kind of settings, but consistently, if you try to determine why is this woman in particular at a specific age range having this new experience hearing in background noise and that kind of difficulty, then it's something to look at. It's something to rule out because it's a factor.
Right. If we're having menstrual cycles, we're going through these rises in estrogen and then falling of estrogen every cycle. Is it possible that if you are in your luteal phase and your estrogen is really low, that you would also experience that difference in being able to hear in background noise? Or is that just kind of like not what the studies are about?
It doesn't get that specific, at least not that I've seen it within a person's cycle. But going back to all of the different factors, if we think about what makes tinnitus bothersome, it's that limbic system, it's the reaction part of our brain. if that reaction part of our brain is just irritated because we've gone through this major hormonal change, all of a sudden, if we're feeling like garbage and our body is just run down, our brain is not primed in that moment to figure out, like, I need to work really hard picking out what's going on around me and what's the speech in front of me. It's not able to. We can only do so much. So many different things that impact how we're just going about our lives and hearing.
That's wild. I had never heard that before. That's amazing. We're going to take a quick break. We'll be right back.
Cause we never really started the female body.
Welcome back to Cramped. We're talking to Dr. Natalie Crossland, an audiologist who specializes in tinnitus, or tinnitus. Either pronunciation is fine, she has assured me. We're talking about the unexpected ways hearing, tinnitus, period pain, and hormones are all connected. Something tinnitus has in common with period pain, I feel like, is that it can be very disruptive to someone's quality of life. But also, it's invisible. You can't see if someone is experiencing this.
Right.
And so I know with period pain, many people experience going to the doctor, telling them they're having this pain that affects their day-to-day life and is like really difficult for them, and getting dismissed and getting told, no, that's normal, you're fine, just ignore it, all of that. Does the same thing happen with tinnitus?
Absolutely. Absolutely. That was actually why I got into this very niche specialty within a specialty, because when I started graduate school, I would be with preceptors and, you're just kind of shadowing when you first begin graduate school. And I was seeing that the same exact thing that I was experiencing with my periods was happening to people coming in to talk about their tinnitus. One gentleman in particular that I'll always remember, he came in religiously every year for a hearing test and would talk about, I'm so bothered by this. I can't sleep very well at night. It disrupts my sleep when I wake up, and at 4 a.m. I can't go back to sleep in the morning. All the things that are very significant when they're happening to you. He was just told year after year, there's not really anything that we can do for you right now. Why don't you come back in a year? He was just told that time after time after time. And I just knew in the back of my head, like, surely that's not the whole answer. I think we just don't have the specialty that we think that we do here at whatever clinic it was. Come to find out after I graduated from graduate school that I really wanted to buckle down and learn as much as I could about this, that there were so many ways we could have helped that gentleman.
I mean, this is just a constant frustration. We talk about it all the time on this podcast. Why won't doctors say, I don't know? Many doctors won't say, oh, I don't know. I don't have a lot of information about that. Let me refer you to another specialist. And also, why won't they Google it? Why won't they read a study? I know they're busy.
Sure.
But the amount of research I've done for my personal health, and then for my friends, when they're like, oh, I went to the doctor and the doctor, he said this is my one option. I could do this, but I don't know if I want to do that. I'll just go it doesn't sound right. And I'll Google it and I'll find a couple studies and just be like, yeah, there's 9 different things you could do for this. Here's the tests you could get. Take this list to your doctor. I don't know where that's happening in the medical training, but huge problem.
Yeah, absolutely. And I think, it's also just human bias as well. A lot of us think that we're just so smart because we got our degrees and that's where it ends. But, you only know what you're taught. You just need to dig deeper.
Well, I tell you what, you don't have that kind of ego when you went to school for theater and then you're talking to doctors on a podcast. That goes away. You said that you learned that there actually were a lot of things that you could have done for this person who had this bothersome tinnitus. What are some of those things? What do you do about tinnitus?
Yeah. So for many, many, many years now, 30, 40 years, there's been something called tinnitus retraining therapy that is very, very effective. It's a set of tools where someone is essentially using something called sound therapy. They're using methods to basically better their quality of life by making productive sleep health changes, for example, focusing on their stress, just making sure that they're priming their brain to go through a new positive plastic change. So basically form new neural pathways where even though the tinnitus is technically there, the reaction part of the brain is saying, I am putting this aside because of what you've been doing with sound therapy. realistically, that would take someone about 12 to 18 months, sometimes more, depending on how significant the quality of life impact is from that person's experience with their tinnitus. We could have done that at that time. That was 2016. Thankfully, there are more methods now. There are even really conservative methods. Like there's a psychologist named Jennifer Gans that has a mindfulness-based stress reduction course for people with tinnitus that sounds very woo-woo. And for a lot of people, if you don't describe it correctly, it does sound very like, I'm going to have you do this because it's all in your head. But ultimately, it's all about calming down the part of the brain that is reacting to the tinnitus. So then, because the tinnitus is technically a benign symptom, it can just hang out in the part of the brain where it's going to hang out. As long as we've ruled out, medical issues and things that it could potentially be causing it besides some kind of subtle hearing change.
That makes so much sense. And I totally understand why that's like difficult to talk about, because the way I used to react when people would be like, have you tried meditating for your period pain?
Right.
And I would be like,
right.
Fuck you. Like,
exactly.
In that case, it was like, yeah, I needed surgery, but also
the
way that all these symptoms, the way your nervous system is upgraded, like, yeah, a multimodal approach is necessary.
Multimodal approach, exactly.
When I finally got diagnosed by an actual specialist and was being treated by the specialist, it wasn't just, okay, meditate. It was, we're going to have you meditate. We're going to have you go to pelvic floor physical therapy. We're going to look into surgery. We're going to have you start with a nutritionist and start taking these supplements that can help you. It needs to happen on multiple fronts.
Yeah.
It's not wrong. That makes total sense of like, I hear a buzzing in my ear. Why would I need to sleep more?
Exactly.
Why would I need to meditate? But it makes total sense knowing that it's that like limbic system connection. Part of what's wrong is that the brain is interpreting something as wrong. The symptoms are real, but also everything is all in our heads because we're just experiencing whatever our brain is telling us is important to experience.
Right.
So that makes total sense and also is really hard to talk about.
Right, absolutely. And for a lot of people, that's not everything. That can be the treatment plan for someone who is maybe mildly bothered by their tinnitus. It's there, but maybe they're like, I notice it before sleep and that kind of bugs me, but otherwise I don't think about it throughout the day. So it has a mild quality of life impact overall. But for a lot of people, we do need, like if it's moderate or more significant as far as the quality of life impact goes, we do need something more intensive. We used to use that tinnitus retraining therapy. We still do sometimes if that's most appropriate for someone. A lot of times what we use now is this whole system that's called linear. So basically instead of just using sound, someone has this goofy little, we call it a tongue tip. It's basically this little electrical stimulation pad essentially that sits on their tongue. They sit back and relax and listen to this for an hour, and then instead of it taking 12, 18 or more months, usually people are done in 3 to 6 months. So it speeds the process up significantly.
What does the electrical thing on their tongue do?
It's an electrode array that stimulates the nerve in our tongue. When the nerve in our tongue is stimulated, the trigeminal nerve, it technically has these little branches at the brain level that communicate to the auditory part of the brain. And it causes the sound to be more efficient and effective. And so instead of it taking about 12, 18 months or so for the limbic system to say, hey, there are subtle changes happening in the auditory system that aren't perceivable to us. It's just the reaction part of the brain is saying, hey, that looks a little different over there. Now that is happening in a much more efficient kind of way. It's been a very successful way of getting people to the point of having essentially non-bothersome tinnitus. It's been in the U.S. since 2023.
Brains are so crazy. Like,
they
what
really
do you
are.
mean something can be 3 times more effective by like gently shocking your tongue to make you hear better? Like, that's so wild.
It is. It absolutely is.
Okay. If someone listening to this is experiencing bothersome tinnitus, maybe at some points in their cycle, but not at other points in their cycle, or they're going through perimenopause and they're noticing changes with their hearing, maybe they've been to their ear, nose, and throat or their audiologist and they've been told like, oh, ignore it, it'll go away. What do you suggest they do? Like, what's a good next step?
That is a really good question, because when it is cyclical like that, that is usually the only time that I will recommend for someone that they start tracking it. Tracking bothersome tinnitus is a really tricky thing to do. You don't want to track it so much that now you have like an Excel sheet where you're scaling everything and really analyzing the tinnitus, because because then that's bringing our focus to it even more, and that's what we want to break
Right.
down. However, if it's coming in these waves throughout a month and it's very obviously connected to hormones, what I would certainly do is come in with the chart saying, this is what's happening, log it for 1 to 2 months, and go to who claims to be a tinnitus specialist, whether that's an ear, nose, and throat physician or an audiologist. But try to look at, are they on their website listing everything that you can do in the specialty of otolaryngology or audiology? So it shows that they specialize in everything. Or are they saying, I specialize in tinnitus for adults, or I specialize in vestibular audiology and tinnitus, or whatever it may be. When it's narrowed down like that, you have a much higher chance of getting someone where that's actually their specialty, rather than they just clicked all of the things to show up on their
Right.
website and they don't
For
actually
SEO.
specialize in it. Yeah, exactly.
That makes sense.
And then you can determine, does it have enough of an impact to potentially send you to your OB and talk about hormone balancing? Or does it make sense to say, okay, we've done what we can do as far as hormone balancing goes. Maybe someone's on HRT, but the tinnitus is very, very bothersome still. Then we treat it like it's bothersome chronic tinnitus. So we turn to either sound methods like that linear device, or we turn to those other methods that really focus in on sleep and stress management and all of that.
Is there anything else that you see over and over again in your patients that you just want to make sure people know?
I feel like I see in a lot of my patients that there's a really strong person inside them, and they are definitely advocating for themselves by the time they get to me. And I'm so proud of them, because I was not doing that when I first started out with dealing with my symptoms. It was just like, I'm going to go tell the doctor what I'm experiencing, and I'm going to expect that they'll push me in the right direction. But it's not always going to be that way. And so if you need to get a little pushy, and if you need to really advocate for yourself, that's not a bad thing. You're not being a negative Nancy. You're not ruining their day. You're advocating for yourself. And so do that with whatever chronic symptom that you're experiencing. It's so important.
Yeah, I had to learn that for decades. I was like, well, I'll go to the doctor and they'll tell me what I need to know. And
Right. Yeah.
turns out, no, you got to know it first and then go in and check their work.
Yeah. And it's very interesting being on the provider side of that, because I can see the generational differences of when you're seeing someone who is a baby boomer or older, a lot of those individuals take what their provider, their physician is telling them as absolute truth. And so they won't go beyond that. A lot of Gen X and millennials are saying, I'm going to ask Google, or I'm going to ask AI first, or during or after. Just kind of like you said, check their work. And yeah, you have to be mindful of that, both as the patient to make sure that you're being guided in the most appropriate direction. And then as the provider, you want to make sure that, am I just regurgitating something that I learned in graduate school 10, 15 years ago? Or is this actually the most up-to-date information that I'm telling my patient?
That makes total sense. Awesome. Thank you so much for coming on and talking to us about this thing that seems like it would have nothing to do with period pain, but actually is pretty connected.
Yes, absolutely. Our bodies are wild.
I am still trying to wrap my head around the fact that our estrogen levels affect how well we can pick out sounds from background noise. I'm going to be chewing on that one for a while. That's it for this week's Cramped. Are you surprised that some of our hearing skills are mediated by estrogen? Did you know that tinnitus can be a symptom of general dysregulation and trauma? Have you had tinnitus dismissed the same way period pain often gets dismissed? Tell me all about it by commenting on this episode in the Patreon. And while you're there, go ahead and become a patron. It is the equivalent of buying me a really cheap drink once a month at a bar where I won't be able to hear you over the background noise because my estrogen is fluctuating. Patreon.com/cramped. See you next time.
What's happening to your body? We don't know, because we've never really studied the female body.